Hello, I'm Dr. Kristen Lorenz, and thank you again for joining me on this journey through COVID-19. This week, I feel that it's important to talk about something called quarantine fatigue. It's a new term we've learned this week. And then we'll discuss ways that we can best take care of ourselves as our community begins to mobilize. We've learned several new terms during this coronavirus pandemic, including social distancing, flattening the curve, personal protective equipment, viral transmission, quarantine, and isolation, just to name a few. This week, we were introduced to quarantine fatigue. Using smartphone data, several researchers have found an increase in our mobility since the middle of April. This involves leaving our home more frequently for non-work related activity around town, as well as more moving out of the county and out of state travel. Warmer weather and the discussions of easing restrictions probably play a role, but quarantine fatigue is clearly generating much of this restlessness. We're now about 7 weeks into the stay-at-home mandate. The commitment we felt 2 months ago is wearing thin. We hear daily about the numbers of new coronavirus cases and the number of deaths, and we really can become numb to them and what they represent. We miss the structure, freedom, and spontaneity of our before coronavirus lives. We miss connection with our friends, co-workers, and distant family. And with spouses and children working and learning from home, we miss alone time as well. We're truly tired, and there's really no clear end in sight. With the biochemical effects of this fatigue, including increased cortisol and adrenal hormone levels, our vigilance wanes and our decisions may not be the best. These responses are quite human and not unexpected, but they can have disturbing consequences for the health and safety of ourselves and our community. The general data shows us that staying at home, physical distancing, and other hygienic practices have been extremely successful in flattening the curve and limiting illness and death. Indeed, countries that implemented these restrictions early have fared the best with the lowest per capita death rates. But the local data indicates that we here in Tucson and in Arizona are not close to the end of the threat. It's important to acknowledge that quarantine fatigue is real, and to have compassion for ourselves and others as it hinders our coping skills and may lead to choices that put us at needless risk. Make a list of things that soothe you, including music, time in nature, playing with your pet, spending time with your children or your spouse, reading a good book, reaching out to a friend, drink some water with lemon or ginger, sipping tea. Make your own list, and it can be long, and it can be varied. These are very important in managing the emotional numbing that occurs with quarantine fatigue. Choose from this list at least once a day, depending on your need. As our community and our state begin to mobilize, it's more important than ever before that we remain diligent with our awareness and our safety practices. I feel strongly that opening too quickly will lead to more illness and suffering, as we really do not have enough of an understanding of this virus to control it. We are just beginning the study process. Let's look at some of the facts that we have learned. One review of public health data has shown that the largest outbreak clusters of coronavirus were found in prisons, religious ceremonies, and workplaces such as meatpacking plants and call centers. These outbreaks involved enclosed spaces with poor air circulation and a high density of people. A review of data from China showed that 90% of infections occurred in homes, workplaces, public transportation, social gatherings, and restaurants. Grocery shopping was found to be responsible for a very small percentage of infections, and even fewer cases were traced to individual outdoor activity. Another Chinese study showed that living with an infected person, sharing transportation, or dining with an infected person resulted in the highest risk of becoming infected with the new coronavirus. We know that the number of viral particles involved affects the risk of viral transmission. But the length of time of exposure we found to be an important factor as well. In a large outbreak at a call center in South Korea, it was found that even persons who were seated 50 feet away from the infected individual, with a low dose of the viral particles in the air reaching them over a sustained period of time, became infected enough to cause severe illness and 2 deaths. This indicates that low level of viral exposure over an extended period of time is as concerning as a high dose exposure at a closer proximity. This might be further illustrated by the different risks involved for workers and shoppers in a grocery store. When we think about the large size of most grocery stores, the restricted number of people allowed in the store at one time, and the limited time one might spend shopping, the chance of receiving an infectious dose is low. However, for the store employee who is there all day with the possibility of more prolonged exposure to the virus, the chance of infection is higher. This type of information is crucial in developing the best recommendations for our safety as we move forward. It's why appropriate testing and contact tracing is so important, because then immediate isolation of infected or at-risk individuals is possible. And this is what will ultimately and most quickly control the spread of virus in our community. As we know, this type of testing and tracing is not occurring in Arizona, at least not to the extent that it needs to. As individuals, we do have the power to take steps which reduce our exposure to this coronavirus, and these same steps keep our family members and our community safer as well. Over the next few weeks, we will be inundated with advertising that will assure us that the restaurants and the salons are doing X, Y, and Z to make their establishments safe. And indeed, I am sure they are putting in great effort. We may feel that we are being given permission to go out and participate without concern. As your physician, I urge you to take some time to think about your choices. As we know, our community has not met 8 of the 9 guidelines recommended before mobilizing. This means that the biology of our community has not changed in the last week or 2. There's no sign that the spread of the virus is abating. Our choices must be mindful. And first, let's review those behaviors that we've learned. The 6-foot distancing, wearing a face mask when leaving home, using hand sanitizers, hand washing, and cleaning surfaces regularly are all still very important. Let's look more closely at a couple of these measures. Physical distancing measures are really effective with brief exposure or outdoor environments. It reduces the concentration of viral particles received by a person who's interacting with an infected individual. But it appears that further measures are needed if we are in enclosed space for prolonged periods of time. Here, as in the call center outbreak, even 50 feet might not be enough. We know that wearing face masks reduces the particles that you put into the air, and remember that we can be infectious without symptoms. In fact, after data review from countries performing appropriate testing and tracing, it is found that 44% of all coronavirus infections are communicated by infected persons who are not symptomatic. So continue to wear a mask anytime you leave your home. If you're walking, bicycling, or running alone, you don't need to wear a mask. But keep it handy so that if you encounter an area of congestion or a group of people, you can slip it over your nose and your mouth. As you leave home and return to your workspace, it's important to assess the risk of viral transmission there. How many people work in your office? How's the air circulation there? An open floor plan carries more risk than having your own office with a door that closes. How long will you need to be in your office space? Can you continue to work from home most of the time? The risk is lower if you go to the office for 2 half days per week than if you are in the office 8 hours, 5 days a week. If your job requires face-to-face talking or singing or yelling, the risk of viral transmission is increased. What's the sick day policy? If you feel ill, it's very important that you stay home. If you choose to visit friends and family, I recommend continuing the 6-foot distancing and wearing a mask. Meet outside if possible, but if you meet inside, try to open windows to increase airflow. If you choose to eat together, eat outside, sit separately, and bring your own food just so that you don't all touch the same items. It gets trickier with small children because they don't understand distancing and they don't do distance well. I especially recommend keeping at-risk elderly away from small children for that reason. Sorry. In general, keep your get-togethers very small and choose your group well. Remember, you are exposing yourself to them and to whoever they may be in contact with as well. As the restaurants open their doors to patrons, is it really important to eat in the restaurant? Inside the restaurant, it is the staff, the other patrons, the closed space, and the surfaces which create risk. We cannot eat with a mask on, but wear your mask until dinner is served. Absolutely no buffets or self-serve establishments can be safe at this point. How much can you enjoy yourself if you're needing to assess the health risk throughout the meal? See what solutions you can find to the risks involved here. Can you order takeout and go for a picnic? This would be significantly safer and still support local businesses. We will get through this, but there have been and will be a lot of change to get used to. The physical distancing and hygienic practices are here to stay for the foreseeable future. Each of us may have our own tolerance level to the risks coming before us. But with mindfulness, thoughtful planning, and making behavior changes at your own pace, the opening of our community can be done reasonably and safely. This quarantine fatigue is real, but it does not need to jeopardize our health. We need to keep going and take things 1 hour or 1 day at a time. Play when you can, rest when you need to, read more, listen to music, try to find the humor and the beauty in every day, and make your activity choices outside of your home with conscience and clarity. Today is Mother's Day. I hope you had a beautiful day of connection with family and friends. My continuing wish for you is that you remain healthy, safe, and informed. Thank you for joining me. Have a beautiful day. Bye-bye.